Hi, my name is Sydney Adamczyk, and I will be discussing the importance of ethics in the field of data analytics. To be successful, all businesses employ some level of data analysis to better understand and address the needs of their clientele. In the digital age, it is easier than ever to acquire personal information that pertains to the customer base. But with increased ease of data collection comes a responsibility for data analysts and businesses in general to ensure that their methods for data compilation, processing, and exchange are performed while ensuring that their clientele is respected in the process. Among these responsibilities are acknowledging ownership of personal data, establishing a transparent relationship with the client, respecting privacy rights, and understanding the intent behind and outcomes of data collection and analysis. Since everyone has the prudential right to their personal information, remaining morally responsible in data analytics is crucial for enabling organizational progress and guaranteeing that organizations and customers alike maintain their personal integrity. For these purposes, I will be focusing on three different industries, specifically the retail, medical, and surveillance industries, to highlight why ethical practices in data analytics are necessary and note areas where these industries can improve upon their moral analytical equity. In the retail industry, personal data collection is performed daily through loyalty program signups. These programs are usually free and offer member-exclusive benefits like sales or coupons, but often require personal information such as names, email addresses, and phone numbers. Unfortunately, there are inconsistencies that arise between in-store and online signups. Most in-store sign-up processes are streamlined. For example, by default, shoppers are subscribed to promotional email and text message content, and the opt-out options are either non-existent or difficult to find during sign-up. Additionally, to speed up the transaction process, employees will often enter the information for the customer, and not every store gives the customer the opportunity to verify the information entered. Above all, associates are not always trained to inform the customer of how their account information is being used by the company. Online signups, in comparison, offer more control and transparency with more accessible privacy policies and opt-out options, as well as the ability to guarantee the accuracy of personal information. But companies can track spending habits and recommend items to purchase during the online shopping experience, often without user awareness. Customers thereby feel an inequity in how they are treated. They may feel improperly informed of the company's access to their information, or feel that the benefits they receive are not adequate compared to what they had to provide the business with during sign-up, among other disparities. Thus, to better accommodate privacy and transparency rights for customers during loyalty program signups, in-store and online sign-up procedures should be standardized in the retail industry. Associates should be given comprehensive training, and making privacy policies and opt-out options easily accessible will build trust and better protect customer data. This will increase the universality of loyalty programs and allow data needed for business growth to be acquired more ethically. Shifting now to the medical sector, there is already a greater improvement in data collection and privacy practices compared to the retail sector. One known policy is HIPAA, or the Health Insurance Portability and Accountability Act. This policy prevents healthcare providers from sharing personal health information to anyone but the patient and anyone that the patient gives consent to knowing. Doctors and other medical professionals are bound by this policy to protect patient records, which is effective but not all-inclusive. A study from Kent University examined over 1,500 classified cases of privacy breaches as described by the Department of Health and Human Services, or HHS. A random sample showed that across different categories of information breaches, HIPAA regulations only covered 65%, and accidental breaches were less likely to be covered than those that were malicious or purposeful. Though HIPAA violations are serious offenses and can warrant extensive fines or jail time, it begs the question of how to better protect patients from HIPAA violations, especially when most medical records are now available electronically. The Kent study also found that almost half of the breaches were accidental. So, while it may be impossible to prevent malintent before it happens, accidents are more preventable. The easiest way, therefore, to circumvent a significant portion of personal medical data violations is to standardize a more robust HIPAA compliance program. Some may argue that such a program would take too long to implement and cost too much money to warrant immediate necessity, but when considering the monetary and time costs that would occur during a medical malpractice lawsuit for violating HIPAA, investing in this program is the better option where both cost and ethics are concerned. Furthermore, making this a standard in all medical offices will give healthcare personnel a greater appreciation for personal data privacy and allow for increased data protection for patients. Overall, this underscores the critical importance of the ramifications of ethical breaches in data analytics, and adherence to privacy policies ensures both maintained trust from clientele and security over sensitive information. Finally, the surveillance sector has amassed much controversy in this millennium, in particular due to the immoral implications of how personal data has been accessed. After the tragic events of September 11, 2001, President George Bush signed the Patriot Act, giving the National Security Association, or the NSA, permission to access metadata from phone records to combat the threat of terrorist organizations. Soon after, the NSA began a secret program called PRISM, which allowed them to obtain personal phone records and other telecommunications records without a warrant, a process sometimes referred to as warrantless wiretapping, also for the purpose of identifying potential terrorists or communication to terrorists. There is not a clear public consensus for the legality of these efforts, but it is often argued that these programs infringed upon the Fourth Amendment, which details search and seizure rights and requires either a warrant or probable cause to obtain personal information. Already an ethical issue arises. Unbarred, unsolicited access to metadata and phone records, regardless of good intentions, reinforces the likelihood for data misuse and results in augmented distrust. People have the expectation that, provided that they don't forego their privacy rights by committing a crime, their phone provider will keep their phone data secure and private. Thus, a government agency collecting this information without user consent is morally reprehensible. Also, assuming that all overseas calls are potential terrorist threats also incites fear-mongering against all international communication. If the NSA were to continue these programs in the age of increased public awareness and accountability culture, warrants would be mandated for any perceived suspicious activity. It would also not be able to remain a secret operation, but revealing the purpose and intent behind the program would improve transparency measures. There may still be legal ambiguities, but it would be morally more acceptable. Therefore, despite the controversial nature of data collection and analysis in surveillance, especially in urgent situations such as 9/11, there are still ways to safeguard individual privacy rights and incorporate ethical procedures for data analysis that can institute trust and a collective understanding for why these measures are performed. In conclusion, it is evident that all businesses and organizations should employ ethical data analysis methods and make it a priority in their daily operations. The guarantees of personal ownership, transparency, privacy, and consideration of intention and potential outcomes are not only a courtesy to stakeholders, but also uphold ethical standards that protect their personal information. While only 3 industries were examined at length, the solutions suggested for moral improvement can extend to other industries with respect to how they collect data and protect the privacy rights of their clientele. By adopting these ethical standards, businesses can foster a culture of trust and accountability, ensuring that data is used responsibly and for the benefit of all parties involved. Consistent application of these principles across various sectors can lead to more robust data protection frameworks, ultimately enhancing the overall security and privacy landscape. Here are all the sources that were used for this presentation, and I hope you enjoyed learning a little more about ethics in the realm of data analysis. Thank you so much for listening.